Hi, my name is Stepfanie, and the title of my project is Hand Hygiene in Healthcare Institutions. There's a lot of backstory to why I chose hand hygiene as a topic for this project. It goes all the way back to my childhood. As a child, my mom always stressed the fact of cleaning your hands and keeping your hands clean. And as a child, I never understood why she would make me wash my hands so much. She would make me wash my hands after coming from outside, uh, before dinner, after school. She would stress the fact, wash your hands at school. And, I never understood why. I always wanted to know the why behind that situation. And then eventually, you know, one day she told me that it's a lot of things out here in the world that can make people sick and people can die. I still had no clue what she was talking about. I was a little kid. So as I got older, I realized, but she always stressed the fact of keep your hands clean. Things can cause you to get sick. She explained, getting colds or getting the flu, it's all about, maintaining, clean hands. And when she broke that down to me and she explained that to me, and I just continued to wash my hands every day. Now 25 years later, and I have a career in healthcare, I try to wash my hands every second of the day. It's is the things I come in contact with every day. It makes me think about how, my mom always explained to me, hey, keep your hands clean. It's really important. I never realized how important it really was until I became a healthcare professional. I deal with different types of people every day. They have different diseases, different infections, and there are a lot of ways to come in contact with that stuff. You catch that stuff, you get sick yourself. And I think that hand hygiene is a must have in every healthcare institution. So I chose this project because, it means a lot to me to keep your hands clean, and listening to mom actually pays off. So I continued to research hand hygiene and the importance of hand hygiene, and I came across two different ways to keep your hands clean. You can keep your hands clean through hand sanitizer, which is an antiseptic rub, or antiseptic hand wash, which is wash your hands with soap and water. And as a tech, I realized that at my place of work, there's a lot of patients with this infection called C. diff, which can be very deadly. Well, it is very deadly. Many people die of it each year. And I never understood that, I never understood, the why behind it. So I did some researched this project, and I found out some very interesting facts. And C. diff is very dangerous. Thousands of people die each year, and it can not only wreak havoc on hospitals but also patients and their insurance. It can cause a lot of damage. So as a tech, I X-ray a lot of patients. There happen to be inpatients that have C. diff. One shift last week, I think I X-rayed maybe 15 patients, and they all were on contact precautions for C. diff. So, got me thinking, and it's been happening for months ever since I started at my new place of work. And it made me think, how can I tie hand hygiene with disinfection in particular? So I did the research and everything, and I found that, hand hygiene can always be improved, regardless whether the patient has C. diff or not, or any other hospital-acquired infection. So what I decided to do was tie these both together and come up with a way to lower the C. diff rates at my place of work. So hand hygiene, of course, can always be improved. And, there's never enough information about hand hygiene. You can always learn something new. So I have to make sure the staff is on the same page when it comes to you know, compliance with hand hygiene, and I have to explain to them why we need to change. So I did a lot of research, and I came to the fact that, C. diff can, you know, it can cost hospitals a lot of money. So that's what I did. I did the research, and the impact of C. diff has increased over the years. 29,000 people a year in the U.S. die from this disease. 29,000. That is a big number. Honestly, that number is bigger than drunk driving car crashes, believe it or not. And each year it gets higher and higher. And people want to know, how come we can't figure out, where is it coming from? How do we stop it? Or how do we, at least lower the rates to make our hospital safe? So 94% of the cases of C. diff in hospitals come from receiving health care from a healthcare professional. So that got me thinking, well, how can I go by, getting everybody on the same page, or making people realize that part of the reason why the C. diff rates are at an all-time high is because proper hand hygiene is not being practiced without offending anyone. So, at the hospital stay, most patients, they get sick and then they have to stay an extra 10 days. So I got into the cost of this infection. Nearly $30,000 per patient in direct costs is only the result of C. diff. And we're not talking about other infections. This is C. diff alone. So most of these, in 1 in 5 occurrences each year within 2 months, each patient, they constantly have to come back to the hospital due to this infection. And some of the reasons why we have patients and inpatients with C. diff is not just because they're being spread in the hospital, but most patients come from other facilities such as rehabs or nursing homes, and they have this, but there's no proper communication between the institution and that institution, so we're unaware if these patients have C. diff or not. So that's, once they get to the hospital, somebody, say everyone has to process them, they have to touch them, get them set up, not knowing that this patient has C. diff. So my key stakeholders throughout this project will be the healthcare professionals, all healthcare professionals, doctors, nurses, EKG techs, radiology technologists, anyone that comes in contact with patients with C. diff physically are going to benefit from this. Also, upper management. I need their support. I need their approval for this project in order to make the institution that they're managing a more safe place. So my process of buy-in is going to actually consist of 6 steps. And those steps include, first, organizing the meeting, making sure everyone at that time frame can be able to come and, meet up and have this conversation about this reoccurring problem of C. diff. Some people may not be aware of the hospital score. They may not look into that. So I will also present that to make them aware of where we stand towards the national average or the average rate of this particular infection in institutions. Okay, the next step would be I will have to explain to them, the effects of C. diff and how it will affect them and how it will affect the institution negatively if we don't get this under control. So the next step would be the burden of costs. Again, nearly $30,000 per patient, 12 days of extra hospital stay, all of that. That will cost, honestly, if we have, 400,000 cases a year, and majority of them come to our facility, that will cost us millions of dollars or more, for C. diff cases alone, not mentioning other infections that patients may have or, contracted during their stay at our facility. So my next step, I would want to propose my idea to change or to be able to track and locate these outbreaks of C. diff. My system consists of sensors and connected to a surveillance system. You know, I would want to have sensors on not just the hand sanitizer dispensers, because we have those everywhere. Most hospitals have that. But most hospitals do not have sensors on their soap dispensers. And some, believe it or not, some of the places, some of the areas in my hospital don't have soap dispensers at all. So I would want to have sensors on those as well in order to track to see who's washing their hands and who's not after touching a C. diff patient. And because the only way to kill C. diff is to wash your hands with soap and water. Hand sanitizer does not kill those spores whatsoever. You have to wash your hands. There's no way around washing your hands after dealing with a C. diff patient. So the purpose of this idea, the purpose of this system change is to do such, just to track, not to invade anybody's privacy, just to track so we can keep an eye on the C. diff outbreaks, so we can find out where these outbreaks are coming from so we can eliminate them. Also, I explained what the system consists of. It'll be sensors on both hand sanitizer and the soap dispensers, and it will be connected to a surveillance system that will track the data, that will give me, statistical data of how each department is doing as far as complying with the hand hygiene rules. And I will explain the budget. I honestly do not think that this system will not break the budget. It may cost money, of course, nothing is free, but I think that this project alone, if everyone complies with this system, I think this system will pay for itself. It will save the institution a lot of money. It will save millions of dollars a year. Each patient you pay nearly $30,000 for, if we can narrow that down, we can save ourselves millions of dollars each year. And I think one of the main reasons why, we have a lot of C. diff patients at my place to work is because we have a lot of elderly people that come from rehab facilities or nursing homes where majority of them fell and broke their hip, or, their coding, so they have to get sent to a hospital facility that can, take care of them and monitor them. And we're more concerned with the patient's, healthcare and well-being. A lot of them forget to ask, how's the patient's doing. We're more focused on the reason why they're there instead of the reasons why they're not there. And C. diff can be one of the reasons that we're not focused on. And that's why the communication channels are not there, and we end up with a patient with C. diff, and we don't find out later until we do tests later after the fact. So it can spread either way. It could come either way. So my timeline, will consist of a few steps. But first, before this gets implemented, I will have to first locate and report the current infrastructures of the hand hygiene at my particular hospital, such as making sure each room, isolation room specifically, make sure each isolation room where C. diff patients will be placed, make sure they have soap dispensers, because some places only have hand sanitizer dispensers and not soap dispensers. And as I said before, the only way to kill the spores from this infection is to wash your hands with soap and water. There's no way around that. So I have to make sure the soap dispensers and hand sanitizer dispensers are in place in order for this, in order for my project to take off once it's approved. So once I've done that, I will also send out an email, email or memo, whichever one comes first, to remind each department of how I'm going to implement this project and when it will be done. I will give them 2 weeks notice so they can prepare themselves and everyone in their department of this change. The next thing I will do once it's installed, everyone in each department will have to test, we'll have to test the sensors to make sure the sensors are working properly in order for us to receive proper data. And all of this data that we get from these sensors, from this surveillance system, will be presented at the end of each month in a statistical chart, maybe a bar chart or a line chart, and each department will have its own color, so we'll be able to distinguish from each of the departments. And I think that this project is going to really open the eyes of many people that work in healthcare. So once it's installed, I make sure everyone is on the same page, and I will also have each, in order to keep each, and keep everyone's thoughts and perspectives in mind from each department, all employees, I will have each department survey their areas so I can have an idea of how they feel about the system and how the system works for them and how they incorporate it into their everyday routine. Because I want to know how everyone feels. I want to keep that line open for communication. I want to be able to have that constant open door policy where people can come and talk to me about this project and how it works and what can be improved, what can be done. So, based on more research about C. diff and hand hygiene, most of the time people don't realize how expensive it really is, or how much, let alone how much money it'll save. Because honestly, some people don't think that C. diff will ever be decreased, or they will never find a way to decrease it. I think that this project will help or aid in decreasing it, keeping that line of communication in, having the data to back up, whether or not we are improving or we're not improving, and reducing the spread of C. diff in our institution. So, as I said before, we could save millions for each hospital institution if we was to implement this project everywhere. Because the current rate at my hospital for C. diff, which is what I got from the Leapfrog website, is 1.2. Is at 1.2 right now. The average score of the average hospital score is 0.9. So my score at my place of work is higher than the average score. And something clearly needs to be done about that. That means a lot of patients have C. diff. And just imagine the patients that we don't know have C. diff, and we're coming in and we're touching them and we don't know what they have, because a lot of things are not being communicated through us once they're sent to us from other facilities. So within a 5-year period, we can save billions of dollars for each patient. We can save billions of dollars if we, implement this project through institutions. We can save billions of dollars each year in savings. That money can go into getting more hand sanitizer, or even more better system if this one is not so effective. All this money can go back into, making the hospital a more safe place for patients to receive care. And all this comes from, the whole purpose of my project is to protect the patient's safety and the safety of the staff and the institution. I want to be able to protect both, because you can't protect one without the other two, because you need all three to be safe: the patients, the staff, and the institution itself, in order for this to work. And without that, we cannot have all of this to work at once if we do not have the proper communication. So this data, will work. It will do that, and it will work. Everyone will have access to this data on our website of how safe we are, depending on, these infections or patient falls, everything. Another part of this project will be the flyers. I will have flyers posted everywhere. These flyers will also be on the website. Post these flyers. It will, it's not about, keeping people on edge. It's not about that. It's also about, creating a safety climate, making people feel comfortable in their department, while complying with these, these hand hygiene rules. The flyer will consist of motivational messages, fun clip art, for people to want. It's designed to make people to want to wash their hands, to want to keep their hands clean, to keep themselves safe and the patients. So the whole purpose of this is to keep hands clean at all times, because it's very difficult to keep your hands clean, because hospital institutions can be busy places. Some people may forget to wash their hands, or they may not have the tools necessary in that patient's room to wash their hands. That's why I said before I could even implement this project, I will make sure that we have soap dispensers, hand sanitizer dispensers, everything that we need in the room in order for this to work. Because there makes no sense to not have a sink or to not have soap dispensers in each room, especially isolation rooms where these patients will be held. So I got to thinking about, the encounters I may, the challenges I may, encounter as a result of this project. The first one I thought about was staff compliance. Honestly, believe it or not, a lot of people have different rules of how they keep their hands clean, and they may come into a conflict somewhere down the line. There are obstacles, and I think this will be the biggest one I will have to overcome in order for this project to work. You know what I'm saying? Because when people think of a surveillance system, the first thing they think about, they're being watched at all times, that people are always going to be in their face, so they're going to always, have to look over their shoulder. That's not the purpose of this project. This project is all about keeping everybody safe. It's all about making sure that, patients are safe at all times, and staff. It's not just about patients, it's staff as well. But the major purpose of this is to be able to track the outbreaks of C. diff and eliminating them. One of the major reasons why C. diff is on the rise is because people don't have the right data or effective data to track it and try to figure out where it's coming from, because a lot of times they don't know where it's coming from. The next one I think I will have the biggest issue, we'll have a issue with, is project approval, because I have to not only convince the doctors and the nurses, but I also have to convince the manager, upper management, the director, the president. Because they also have to approve this in order for me to use the hospital's budget for this system. So I have to be able to convince them of how this system can save them money in the long run. Because since now they're aware of how much C. diff cases cost, and the 12 days of stay, and the constant reoccurrence of it, I think they would understand completely where I'm coming from. This will help with the system, help retrieve that data, and they will have this data on file, to show that they are, trying to eliminate the C. diff rates. The last one will be financial. I think that the financial problem won't be much of an issue, because Russia's a big hospital, and they are currently expanding to different places in South Loop, River North, where I'm currently at now, and also in Oakbrook. So I think that, financial reasons will not be a problem. But I think it could pose a problem, but it wouldn't be a problem that I can't easily overcome. Because I think that this system will pay for itself. It will save the few $100,000 you may spend on this system can save you millions each year. So I think that this is a win-win for the institution, the staff. I think this will be one of the best budgets they ever came across, best things they ever saved. The main purpose of this project is to wash away the C. diff, to stop the rates of C. diff as they come in, have that proper communication with where the patients come from first, because C. diff affects mostly the elderly and little children. But at my place of work, it's mostly the elderly that come there, and they come from nursing homes and rehabs with C. diff, or they acquire C. diff in the place where I work, and a lack of communication is mostly the problem. So I think C. diff can be lowered, and I think my project will aid in, well, at least if not aid in, if it won't aid in, it will at least help, eliminate majority of the cases that come through there each year, and kind of get that leapfrog rating down and keep our ratings, low. It'll keep our grades high, but keep the ratings low, because that is one of the biggest issues at my place of work, and I think this project is really going to help. Thank you.